We're Acentra Health, the beneficiary and family-centered care quality improvement organization for 29 states, focused on supporting people with Medicare and their families. Our services are free for Medicare patients. We also work with healthcare providers by sharing helpful information and resources to support their day-to-day work. This video goes over how to use the case status tool on Acentra Health's website to get updates about an appeal that has been started. The case status tool gives you updates on appeals in real time, so a phone call to Acentra Health is not needed since the tool is always available. When a Medicare patient makes an appeal, a case ID will be provided. Healthcare providers, such as a hospital, can find the case ID on the medical record request form that is faxed to them. This ID will be in the following example format. The first numbers represent the date, and the last two letters are the initials of the patient. There will be another number in the middle. To check the status of an appeal, go to acentra.qio.com/case status and type in the case ID on the online tool. A link to this page is included in the description below. The case ID is case-sensitive and needs to be typed in exactly as it was given to you. The 8 stages of review consist of the following: discharge appeal started, medical record requested, documents received, in clinical review, physician review completed, determination made, notification, and case complete. Once you hit the search button, you will see the completed steps of the appeal. Now let's look at each of the 8 phases in more detail. Phase 1 means that the case has been filed by the Medicare beneficiary or representative and is in the Acentra Health computer system. Phase 2 means that Acentra Health faxed a medical records request to the facility or healthcare provider that issued the notice to the beneficiary. Phase 3 means that Acentra Health received medical records from the facility or healthcare provider. If the medical record is missing information, Acentra Health will contact the facility or healthcare provider to ask for what is needed. If that information is either not sent or not sent in a timely manner, Acentra Health will close the case and a new notice will have to be issued. Phase 4 means that the case is being reviewed by one of Acentra Health's physician reviewers. Phase 5 means that the physician reviewer has completed the review and has sent the case back to Acentra Health. Phase 6 means that Acentra Health has made the determination whether the patient's service should continue, and financial liability has been set if it is determined that the patient no longer needs services. Phase 7 is the notification process where Acentra Health shares the determination with the patient and healthcare provider. Acentra Health contacts patients and acute care facilities, such as a hospital, by phone. Medicare Advantage plans are also contacted by phone for acute appeals. All other providers are sent a fax within 30 minutes of notification of the patient. Phase 8 means that the case is complete. Everyone should have received the determination by Phase 8. The case status tool is easy to use, will provide a patient a real-time update, and is always available. If this video was helpful, please subscribe. Click the notification bell and you'll get notified whenever we post a new video. Thanks for watching. If you have questions about Acentra Health Services, visit acentra.qio.com. Take a look at the YouTube video description for more information, including web links and resources.